Have you ever been sitting quietly, maybe having your morning coffee, when for just a split second your hand felt strange, a little numb, a little clumsy, and then it passed so quickly you told yourself it was nothing? Or maybe you've noticed a friend, someone you love, suddenly slurring a word or two mid sentence and then laughing it off as just being tired? If any part of that sounds familiar, I need you to stay with me for the next few minutes because what I'm about to share with you could be the single most important thing you watch this year. This isn't here to scare you, it's here to protect you. And by the end of this video, you're going to know exactly what your body has been quietly trying to tell you. Let's be honest with each other for a moment. After 50, our bodies start speaking a different language. Aches show up where there used to be none. Energy dips at times it never used to. And so we've all learned in a way to tune some of it out, to assume it's just age, just stress, just a bad night's sleep. And most of the time, that assumption is perfectly fine. But there's one area where that habit of brushing things off can be dangerous. And that is when it comes to the warning signs of a stroke. Because here's something most people don't know, something we're going to come back to in detail later in this video. Many strokes don't happen suddenly and dramatically like they do in the movies. Many of them whisper before they shout. They send a small, quiet signal days or even weeks before the real event. And if you know what to listen for, you can act in time to change everything. Stay with me because I'm going to walk you through exactly what that quiet signal looks like and how to tell it apart from ordinary aches and pains. Now, before we go further, let's agree on a few simple truths. You want to protect your independence. You want to keep doing the things you love, spending time with your grandchildren, taking your morning walk, gardening, traveling, simply living life on your own terms. You've worked hard for the life you have now, and you deserve to enjoy it fully for as long as possible. I think we can agree on that. And I think we can also agree that knowledge is one of the most powerful tools we have for protecting that independence. The more you understand your own body, the more control you have over your future. That's really what this video is about. Not fear, not panic, just clarity. Because when you know what to look for, you stop feeling powerless and you start feeling prepared. So let's talk about what a stroke actually is. In plain, simple terms, a stroke happens when blood flow to part of your brain is suddenly interrupted, either because a vessel is blocked or because it bursts. And brain cells, unlike most other cells in your body, cannot survive very long without that steady supply of oxygen and nutrients. That's why doctors say time lost is brain lost. Every single minute matters. But here's the part that changes everything. The part I promise to reveal. Many people experience something called a transient ischemic attack, often just called a mini stroke. In the days or weeks leading up to a full stroke, it behaves almost exactly like a stroke. The same symptoms, the same warning signs, except the blockage clears on its own and the symptoms fade, sometimes within minutes. This is your body's warning shot. And the first sign is sudden weakness or numbness, especially on just one side of the body. This is often one arm, one leg, or one side of the face. It's not the general tiredness we all feel. It's a distinct heaviness, a strange looseness, as though that limb suddenly doesn't quite belong to you the way it did a moment ago. If you ever notice this, especially if it comes on quickly and affects only one side, please take it seriously. The second sign is sudden confusion or trouble understanding what people are saying to you. This one is often overlooked because it's mistaken for simply being distracted or overtired. But if you or someone near you suddenly seems lost in a conversation, unable to follow simple instructions, or responding in a way that feels oddly disconnected, that confusion deserves your full attention. The third sign is difficulty speaking or slurred speech. You might notice words coming out jumbled, or a friend suddenly struggling to find simple words they use every day. Sometimes it sounds like they've had a little too much wine, even when they haven't touched a drop. As you start to notice these details more closely in the people you care about, you'll find it becomes second nature to catch this early. The fourth sign is sudden trouble seeing in one or both eyes. This might show up as blurred vision, double vision, or even a curtain-like shadow falling over part of your sight. It can be brief and it can be genuinely unsettling. But many people simply blink it away and move on with their day, assuming it's just tired eyes. The fifth sign is a sudden, severe headache with no known cause, often described as the worst headache of your life. This is different from a regular tension headache or a migraine you've had before. It comes on abruptly, intensely, and feels distinctly unfamiliar. The sixth sign is trouble walking, dizziness, or a sudden loss of balance and coordination. You might feel as though the room is tilting or find yourself stumbling for no clear reason, almost as if your body and your brain are no longer perfectly in sync with one another. And the seventh sign, one that's often the most quietly dismissed of all, is a sudden, severe fatigue prepared with any of the symptoms above, an overwhelming bone deep tiredness that seems to come out of nowhere, as though your entire body is asking you to stop and pay attention. Now, here's the part I want you to really absorb. Any one of these signs on its own can have other, more harmless explanations. But when they appear suddenly, especially in combination, and especially if you're over 50, they deserve immediate attention, not a wait and see approach. There's a simple method doctors use to help people remember the most urgent signs, and it's worth committing to memory. It's called FAST. F is for face. Watch for one side drooping when the person smiles. A is for arms. Ask them to raise both arms and see if one drifts downward. S is for speech. Listen closely for slurring or strange word choices. And T is for time. Because if you notice any of these, it's time to call emergency services immediately. Not wait an hour, not sleep on it. Right away, as you begin to picture this simple checklist in your mind, you'll notice how much more confident and prepared you feel because now you have a clear plan instead of just a vague worry. I want to pause here and ask you something because I genuinely love to know your experience. Have you or someone close to you ever noticed one of these symptoms, even briefly, and wondered afterward if it was something more? Maybe it was a moment of numbness that passed quickly, or a strange slurred word that seemed to come out of nowhere. I'd really love for you to share that in the comments below. Not to alarm anyone, but because these stories help all of us learn to recognize these moments faster in ourselves and in the people we love. I think of the comment section like a conversation between friends looking out for one another. Now let's talk about why this matters so much more after 50. Specifically, as we get a little older, several factors quietly increase our risk: blood pressure that creeps up over the years, cholesterol levels that shift, irregular heart rhythms like atrial fibrillation, and simply the natural aging of our blood vessels. None of this is meant to worry you. In fact, understanding these factors puts the power back in your hands. Because, unlike some health risks, stroke risk can be meaningfully reduced through everyday choices. Staying physically active, even something as simple as a daily walk, eating meals rich in vegetables, whole grains, and healthy fats, keeping your blood pressure in a healthy range, managing stress, and having regular checkups with your doctor, all of these genuinely make a measurable difference. As you begin making these small adjustments in your daily routine, you may start to notice your energy improving, your mind feeling clearer, and a growing sense of confidence in your own health simply because you're taking an active role in protecting it. I also want to gently address something many of us feel: that quiet hesitation to make a fuss, to call for help over something that might turn out to be nothing. Maybe you felt that yourself, telling yourself you don't want to bother anyone or that it will probably just pass on its own. That instinct is completely understandable. Many of us were raised to be strong, to not complain, to push through discomfort quietly. And I want you to reframe that instinct today. Calling for help when you notice these signs isn't making a fuss. It's an act of self-respect. It's you telling your own life that it matters enough to protect. And if you notice these signs in someone else, speaking up isn't overreacting. It's one of the most loving things you can do for them. So let's bring this all together now. We talked about how strokes often send a quiet warning before the main event in the form of a mini stroke or TIA, symptoms that mimic a stroke but resolve on their own, only to potentially return more seriously later. We walked through the 7 signs together: sudden weakness or numbness on one side, sudden confusion, slurred or difficult speech, sudden vision, trouble, a severe unfamiliar headache, dizziness and loss of balance, and an overwhelming sudden fatigue. We talked about the simple FAST method to remember the most urgent signs, and we talked about the everyday choices that genuinely lower your risk moving forward: movement, nutrition, stress management, and regular checkups. I want you to walk away from this video feeling not afraid, but genuinely empowered. You now know something that many people don't. You know what your body might be trying to tell you, and you know exactly what to do about it. That knowledge alone puts you in a stronger position than you were in 15 minutes ago. And that is something to feel good about, If this video gave you even one piece of information that felt valuable, I'd be so grateful if you take a moment to like it so more people in this stage of life can find it too. And if you know someone, a parent, a sibling, a close friend who might benefit from hearing this, please consider sharing it with them today. It genuinely could make the difference between a close call and a tragedy. And if you haven't yet, subscribe to this channel because we're going to keep having these honest, caring conversations about how to protect your health and your independence, one video at a time. Take care of yourself this week. You deserve every good year still ahead of you.